Welcome to the Sunday Night Health Show podcast. Okay, we're also going to be talking about some of the autoimmune diseases that you can get after getting a COVID infection. You know, a lot of people are really apathetic about COVID. There's a little bit of vaccine hesitancy going on out there. People are like, I wasn't even that sick. I'm not worried about it. It's like a little cold. Who cares? But it's actually not just a respiratory virus. It's a neurological disease, and there are some other medical conditions that you can get. Autoimmune diseases are horrible. So I'm going to be reviewing that for you as well. But let's see, a little inspirational poem for all of you out there who might be struggling at the moment. And, you know, there's times in life we do struggle. And, you know, if you turn on the news, it's just heart wrenching and horrible what is happening out there. So just trying to make things light and a little hopeful. And so to that end, joining me on the line right now is none other than Dr. Tomi Mitchell. You've heard her voice many times before. She's a medical doctor, family physician who's also a productivity coach. Her website is wellnessstrategies.com. That's with three S's altogether, wellnessstrategies.com. Good evening, Dr. Mitchell. How are you?
Good evening, Maureen. I'm well. Thank you for the kind introduction.
You're very welcome. Thanks so much for joining me on the program tonight. You know, we hear these things like Suzanne Summers died of breast cancer uh, very recently. I'm not exact. Maybe it was today. I'm not exactly sure. I think it was. And also this week we heard that Mary Lou Retton, the American gymnast, was severely ill with a very unusual form of pneumonia. We're heading into the winter. We're heading into flu and COVID season, what has become COVID season, and also pneumonia as well. For the listeners, could you just tell them what pneumonia is?
Yeah, a pneumonia is an infection that affects part of the lungs. It could be a small lobe, it could be the entire side. Just think of it as an infection. It could be bacterial, it could be viral, it could be rarely parasitic, but I mean, it's an infection in the lungs, and it sucks.
Yes, and to put it bluntly, and how so Mary Lou Retton, from what I gather, was on a ventilator, so she needed respiratory support, which is very frightening. We heard a lot about that. People must have learned about that during the pandemic. So you know, you don't typically think of somebody needing ventilatory support. First of all, how is pneumonia treated, and are there a couple of kinds of pneumonia?
Yeah, so pneumonia, it's often treated with antibiotics. Well, most bacterial type. There's viral pneumonias. There's rare, like parasitic pneumonias, but I mean, typically bacterial is the most common, and then viral. So you treat the infection, and then you give supportive treatment, because we know that most viruses have to run their courses. So if someone is not breathing properly, we give medications to help them breathe properly. If you have a fever, we give medications to help you reduce your fever. We hydrate you if you're dehydrated. So there's various types of pneumonia, and obviously varying severity. Definitely, this case was extremely severe and life-threatening, because by the time you're in ICU, it is really bad. So I'm glad she's pulling through.
Oh, absolutely, and there was some good news delivered today by her daughters that she was actually had turned a corner, was starting to get better, and so we're very happy about that. But also, you know, how is pneumonia prevented, and are there vaccines to prevent pneumonia?
Yeah, there are.
The V word. The other V word.
I know. Yeah, the other one for you, especially the work you do. Vaccine. Yeah, so just like
Vagina
COVID.
advisor.
Exactly. So airborne. 54% of pneumonia is caused by dirty hands, right? Airborne. Someone could talk to you and have pneumonia and spread particles of joy in the air, and you inhale it, and voila, you have an infection. Obviously, not washing your hands before you eat. That was really popular during COVID. I think it kind of fell off popularity. I don't know why. Lately, people tend not to do that anymore. So, someone sneezing, coughing, that's pneumonia. It spreads very easily.
Right. And what are some of the symptoms that people would experience?
Yeah, it could be sudden onset high fever, chills, productive cough, shortness of breath, malaise, this generalized tiredness, just not feeling like yourself. And there's some people, honestly, walk-in pneumonia, quote unquote, pretty much feel okay, but don't realize that their body is fighting this infection. I've seen that too, where they just kind of feel generalized, just meh, but not like sick, but they have pneumonia.
Mm-hmm. Yeah, and some people just are prone to pneumonia, aren't they? They can get it one year and then get it. They're
Yes,
kind of susceptible to it, I should say.
100%. So anyone who's immunocompromised and even age over 65 is a risk factor. That's so heartbreaking, right? So
Mm-hmm.
diabetic, any medications can compromise your system. Someone who's had the flu or COVID, that can
Mm-hmm.
weaken your immune system and then trigger a superimposed like infection on top of that, like pneumonia. So
Mm-hmm.
someone who's stressed, someone who's not sleeping well, someone who's not eating well, somebody who's carrying a bunch of extra weight classified as obesity. Like there's so many risk factors for pneumonia.
Right. Absolutely. But people typically can recover from pneumonia.
100%. Most of the time, people just think they have a really bad cold. They recover.
Mm-hmm.
However, as we get older and as more chronic diseases kind of pile up on a person's body, pneumonia is not just, oh, it's just pneumonia. No, it can be life threatening and it
Yeah.
can be very serious.
And we have to really take care of ourselves, especially as we head into the winter and we all head indoors. And people probably aren't being as diligent about washing their hands, and we're not really
Oh,
having
not at
the
all.
mask. Yeah.
Right? And the hand sanitizers, they're like disappearing from the gas stations and stuff. Like you don't see them. Like, where's the, like, what happened? What happened?
Exactly. Exactly. And the
And there's a
uh,
vaccine you mentioned. Yes, there's a
yes,
vaccine
the
as well.
vaccine as well, so people can get the pneumonia vaccine to prevent that. And if you're at risk, if you had it before, if you're a certain age, you probably should get it. But what was I going to say? I've lost my train of thought now about, oh, I can't remember what it was. But anyway, oh yeah, people aren't wearing masks, and so
Yes,
when we were all wearing masks, there was this little side benefit that you didn't get any upper respiratory tract
yes.
infections. It was awesome.
Patients said that all the time. Like, doc, I've hardly been sick, and I don't know why. And I'm like,
Yes,
really? Let me tell
ex-
you something. This is
exactly.
why.
Exactly. Have you had pneumonia out there? 1-877-399-9898. I'm going to be reading all these text messages that I've been getting that have been coming in here in the last couple of minutes, in a couple of segments at the 9:30 hour Pacific time, in about 15 or 20 minutes. Because right now I saw a very interesting article, Dr. Mitchell, about
Yes,
how people, and we know that Ozempic is a wildly popular drug.
yes,
So many people are on it. People who shouldn't be on it are on it, or are also on Wegovy, because it's used for diabetes type 2. However, a lot of people are using it for the weight loss
yes.
benefit that it has. But we're also seeing some side effects that are frightening, like gastroparesis and
Hmm.
constipation and nausea and vomiting. Not something I'd want. But I totally understand people who want to use that medication in conjunction with their physicians. But there's so many online prescriptions, and just everyone and their brother seems to be on it. And
Hmm.
people are looking good. People are dropping the weight. And now it's
Yeah.
like if I see somebody who's lost weight, my first thought is like, I wonder if they're on Ozempic. They have to
Oh,
stay
yeah.
on it. My guest is Dr. Tomi Mitchell. You've heard her voice before, certainly. She's a medical doctor, family physician, who's also a productivity coach. Her website is wellnessstrategies.com. Reach out if you need her assistance. She's awesome. We were talking about pneumonia because Mary Lou Retton has been hospitalized but is doing better, fortunately, as a result of a very rare pneumonia. And now, thanks so much for staying on the line, by the way, Dr. Mitchell. Appreciate
My
it.
pleasure.
So I saw this, these weight loss drugs, Ozempic, Wegovy, which are costing, I think they cost about $1,000 a month if you don't
Yeah,
have
in the U.S.
insurance.
Yeah, in
What's
the
that?
U.S. It's 1,000 in the U.S. About 250 in Canada.
A month?
Yeah, 1,000 in the U.S. It's about 250 Canadian dollars
Uh,
in Canada.
oh, that's a bargain in Canada. That's like
Oh yeah, Canadian drugs are much cheaper. Mm.
wow.
Yeah, 1,000 U.S.
Okay.
dollars.
1,000
Yeah.
US dollars if you're in the US, but $250 Canadian
Yes.
if you're
In
in
Canada. Yep.
Canada?
Mhm.
Wow. It's awesome. Um, and so many people are on it, and then now that you've just said that about the price, more people are going to go on it. That
I
you're going to
know,
save
right?
money in food. You're going to eat way less food when you're on this medication. So that's going to cover the cost of like $61 a week. Anyway, so
Yep.
that's awesome. But there's another benefit that weight loss drugs may help, and it's estimated to save, guess who? The airlines millions. Do you know why? 1-877-399-9898. Anyway, Dr. Mitchell, do tell us why weight loss drugs can save the airlines millions, and hopefully it's going to be passed on to the consumer like me because I love to fly.
Yes. So it's saving the airlines millions, if not billions, because the more weight the plane carries, the more jet fuel it burns. So even just like the average person loses 10 pounds, which honestly isn't a lot, they're set to save billions a year, right? We talk about airlines charging for um, every suitcase, charging for everything, and that's in their attempt to improve their bottom line. But yeah, there's definitely savings for the shareholders for the airlines. Whether or not they'll pass it to us, I don't know. I hope so, but who knows?
Yeah, I mean, I know that that airlines are obsessed about reducing jet fuel. I mean, we're
Oh
all
yeah,
obsessed about reducing
yes,
fuel. People are buying electric vehicles, people are buying the hybrids. It was costing me like $125 to fill my tank just about 2 weeks ago. And then
mm-hmm.
last week I did notice a drop and it only cost 100. Um, but the cost of fuel for all of us is, it's outrageous. But for the airlines, the prices, I don't know if you've been flying recently, but
Oh,
if
I
you've
fly
seen like,
lots. I fly
yeah,
lots.
and a lot of people, have you noticed the prices of the airline tickets going up?
I definitely have, and people aren't happy with it. And it's also to talk about trying to fit more people in the plane. They're talking about these like new chairs where you could basically have people stacked on top of each other. Like it's crazy in the attempt
Yeah,
to again that bottom line. But maybe if we have a compromise between weight loss and then we get some convenience back, maybe some leg space, some free snacks, maybe. Who knows?
absolutely. Nobody's
Maybe
going
we'll
to
be
eat them
like
because
flying in the
everybody's on
'90s
Ozempic.
again.
Yeah,
Yeah.
everyone's on Ozempic, so they won't be eating them. They won't even need to give snacks out on planes. But looking to another industry, for example, like restaurants,
Yes.
people may not, they might lose money. People might not be ordering the appy, the salad, the main, the dessert, the wine. They may not have room for all of it.
That's
If they're,
true.
yeah,
That's true.
I think we're going to see big economic changes.
I'm
Um,
excited for it, Maureen. I'm like giddy excitement.
well, they're going
It's
to
true.
raise the prices of restaurants. So they're
It'll
going
be
to raise the
probably
price. And restaurant prices are through the roof right now. But I
yes,
have noticed they're giving a little bit more food these days, which I don't really care for because in the U.S., I mean, the plates are massive. Here, they're not
yeah,
so bad in Canada,
yeah,
but they're
yeah,
getting more and more. I will notice. I have noticed. One other question I had for you, just in terms of um, Suzanne Summers passing away
yeah,
today. God rest her soul. Um, she's talked a lot about, and menopause is having a moment, let me say. There's a lot of talk about menopause. Some people don't want to hear about menopause, but a lot of people have not been educated about menopause, whether it be women who go through menopause, if God willing, if they live to that age, they will go
yeah.
through menopause. Some women will be symptomatic. A lot of women will not be symptomatic. Those who are symptomatic, they can suffer tremendously. There's all sorts of choices out there. I talked earlier with Tim Caulfield about this. I just am just livid about the misinformation and the marketers all over Instagram. Taking advantage of people at a certain time of their life, and in particular perimenopause and menopause. The time period can last like 10 years, and they get
Yeah.
misinformation, or they get. I mean, I saw a ridiculous question the other day. I mean, a good question. Sorry, a ridiculous answer by somebody who's not a medical professional and just asked a question about the use of Premarin cream, and they went, just gave, in this effort to just say anything, I guess, because they want to keep a customer. gave an answer instead of saying, I'm not a clinician. I don't know why that is not working for you. I knew why, you know, I mean, because I deal with this on the daily. But Suzanne Summers was somebody who wrote a lot of books and promoted bioidentical hormone replacement therapy, and yet she ended up getting breast cancer and ultimately dying of breast cancer. And continued. My understanding is she continued on that um, after, while during her breast cancer diagnosis. Um,
Yeah.
what are your thoughts on misinformation? We only have about 30 seconds. Sorry.
Yeah, it makes my blood boil, especially when there are people who actually know what they're talking about. But again, let's do something with it. Let's continue to talk about it. Let's continue to talk about these articles and answer, because we're both clinicians, we're both experienced, and it's our duty to say something, because people are listening to quacks half the
Yeah.
time on social media, and that's a fact. That's putting it nicely, and they're dangerous.
It,
So, and that's what really bothers me a lot, because people are being harmed.
That's right, and they're dangerous salespeople. That's all they
Yes.
are. They just want to sell a made up program. And the other thing I often think that the clinicians, the doctors, the nurses, the pelvic floor physiotherapists, the pharmacists. I mean, they're doing the good work. So, not all pharmacists. Some
Yeah.
they're more dispensing medications. No, but the people
Yes.
like are on the front lines. They're medically trained people, and patients are coming. I mean, I'm overloaded. Have a wait list. I'm sure you're the same. You
Yeah.
know,
That's busy.
and it's at least the people are coming to see us anyway. Well, thank you so much, Dr. Mitchell. I really appreciate you coming on the show once again.
My pleasure. My pleasure.
Thanks for listening to the Sunday Night Health Show podcast. You can subscribe, rate, or review on your favorite podcast app. And if you've got a question about your health, the nurse is always in. So email me, nursetalk@hotmail.com, and I just might answer your question anonymously, of course, on next week's show. For now, have a happy and healthy week.